As a pediatric dentist, one of the additional training modalities that we receive in our specialty training is sedation and sedation dentistry and working with children that are under sedation or even under anesthesia. This is accomplished through a residency of training where we become very comfortable at doing dentistry on children of all ages while they are under the effect of sedation. At Sheppard Pediatric Dentistry, we offer two main types of sedation. The first type is what we call oral conscious sedation. This is achieved by the children drinking a small amount of medication and then waiting for 45 minutes to an hour while that medication takes effect as they watch TV and relax. This is a very light sedation. Rarely are the children totally asleep, but it many times is more than adequate to take the edge of the anxiety off so that we can complete restorative treatment or treatment that needs to be done, or even sometimes just x-rays or cleanings on kids with severe anxiety or inability to sit in a chair to achieve those treatments. So the oral conscious sedation is a light sedation, but it is one that we utilize every single day. It allows the children to be very relaxed, and following the treatment, they have very little memory of anything that happened due to the amnesic effect of the medications that we use. Our oral conscious sedation has an effectiveness of 70 to 80%. So 20% of the time, this particular sedation method will not be successful in getting the kids sleepy enough. Sometimes it will make them very aggravated. Other times they will still be wide awake and appear to have no effect from the sedative at all. This is due to children's different rates of metabolism and the different ways that their bodies utilize the medication. Since it is completely unpredictable, we offer to parents the option of trying the oral sedation. If it does not work, and if it is not successful for their child for us to complete the needed treatment, we do not charge for it, because that result cannot be told until after we have administered the medication, waited the prescribed period of time, and then been able to see what result it will have on the child. Although it is not 100% successful, oral conscious sedation is a very effective and very common and very commonly used method for helping children that need to have restorative treatment, to have it in such a way that will eliminate their fear and anxiety. The second type of sedation that we offer at Sheppard Pediatric Dentistry is known as IV anesthesia. This anesthesia is administered by an anesthesiologist who comes here to our office, and they are skilled pediatric anesthesiologists that will come and put the child to sleep, completely asleep. The child is able to fall asleep while in his parents' arms, and once they are asleep, they are then taken back to the treatment room where we perform the dental treatment with them asleep. And then as soon as the dental treatment is completed, they are woke back up having no remembrance of anything other than sitting on their parents' lap as they fell asleep. This is a fantastic option, and usually our last option, if none of the other methods that we utilize have been able to work for the child. This is very predictable. Every child, every time, will go to sleep, and all the treatment that needs to be done will be able to be done regardless of how long it takes. We recommend this treatment many times for very young children, or for children that have a lot of restorative dentistry to do that would require multiple visits. This allows us to get everything done in one visit. The anesthesiologists are board certified pediatric anesthesiologists who are able to bring their equipment here to the office and administer the anesthesia in a method that is both safe and very effective.